I think the universe chose me to work for FNHA. I found it through Facebook. My friend posted something about BC's health plan, and I clicked on it, and then FNHA came up, and I went, oh yeah, I forgot that this was happening. I knew in the back of my mind it was happening, and then I saw the jobs, and I'm like, I really need to apply here. Working in community, being a part of the community, doing something that you're really passionate about. It's not like hospital nursing, what I did for like 15 years before coming here. This is so much richer. The culture, the environment, living, in rural and remote communities. And it's not just nursing as a job, but as a way of life. The nurses that work in our nursing stations, they're it. There's no doctor, there's no NP. They come in once a week, but you're the primary care provider. So if you're ready to go take it up a notch and be that autonomous provider with a bigger scope of practice, and you're ready for that challenge, we want you. We want the people who can think critically, who have cultural competency, who really want to be a part of something that is transformative in change. When you look at the rest of Canada, BC is the only one that has this kind of nursing that is specific for First Nations, run by First Nations people. We're a transformative organization, and if that's your passion to be transformative, give us a call. That's what we're here for. If you want to come work for us, we have a lot to offer. If you're not remote certified, we will put you through the remote certification program, which is run through UNBC. When I get to work with nurses who are working in our communities, one of the biggest things that I bring to them, being First Nations, having worked in First Nations communities, my family's First Nations, is we're not working for the community, we're working with the community. Community nursing in First Nations is unique. It is different. Nurses are telling me that when I put it back on them to say, did the community ask for this? And they're like, well, no. Then I'm like, okay, then go back. You need to work with the community, not for the community. I look at humility, and in particular cultural humility, as being teachable. And part of that being teachable is to sit and listen. And that's how I practice my own when I'm learning not about even my own culture, but other people's culture, other people's ways of being and how they present themselves, is to really sit and listen and be teachable, because it's important to meet people where they're at, whatever culture they come from. But when you're coming into a culture such as ours that has such a rich history, good and bad, if you can't meet them where they're at and listen and go, yeah, there's a chronic disease. Yeah, they might have diabetes or hypertension, heart disease, but there's a story behind that. There's a story about why it got to be a chronic disease. We don't know about if they went to residential school, what other family history is going on for them. So if we can really meet people where they're at in their community, we're going to get so much more, and it's going to be a relationship as opposed to a nurse coming in going, okay, I'm going to get this done for you, and kind of checking my agenda at the door, and then just sitting and being. Everybody has a voice, and everybody gets to voice what they want to say or need to say in a safe manner. And I feel that FNHA is really trying to walk their walk and talk their talk. Whatever kind of organization you're part of, the respect that you put forward and is put back to you, you're going to get so much more done. And you feel valued.